Hello, everyone. Welcome to Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. Today, we are discussing integrative medicine, a holistic approach to healthcare that combines conventional treatments with evidence based complementary therapies to support your overall well being, physical, mental, and emotional. Joining us today is a representative through NguiStyle Integrative Medicine Clinic, here to share what you should know about integrative medicine and how it can support your health journey. We want to help you learn more, so let's learn together. Justin, welcome to our show.
Thank you very much.
Can you share with us a bit about yourself and tell us your role at Nine Style Integrative Medicine Clinic?
Well, a bit about me is I've been doing this since I was a little kid. Our family, we passed down medicine traditions, father, son. So we've been doing that for 23 generations. I'm the 24th. So it's a lineage-based knowledge. With every generation, of course, we're learning new things and getting modern adaptations to time-honored traditions. So that's a very important piece. That knowledge doesn't just end when people pass on, but gets passed, and those things continue to be learned. So every generation has more than a single generation of knowledge. That is a huge body of knowledge to have. So I'm running the Chinese medicine side of the clinic. So we use acupuncture, we use herbs, lifestyle, we talk about diet and exercise. There's also another side which uses vibrational frequency and sound therapy, and we also use more modern tools like laser therapy. So we're doing all of these things together, which is why we called ourselves the more of an integrative medicine clinic.
Yes.
We're taking the old approaches and then mixing them with modern tools and coming up with a holistic approach that works for this day and age.
Yes, and that is wonderful. I think with everything that is happening, or the different ailments, or different accident, whatever it is that impact in the community, is always good to have a way of dealing with these things, and that's why it's so important to have services like yours, or for the public to actually know about what's available to them. Can you share with us, for viewers who may not know, what exactly, from your perspective, in terms of how the public should understand when it comes to integrative medicine, how would you describe that from a point of view that would allow the average person to understand truly what integrative medicine means?
I would say that it is it is exactly what the word sounds like. It's integrative. I think that more and more people are realizing that although Western medicine is very good at what it does, that sometimes it just falls short of being able to help people in the way that they need, which is the case of every medicine. But I think with the more traditional approach, also there's holes and things that it can't do that are more modern. So being able to bridge that gap between the more modern and the traditional approach to like a old Chinese medicine, things like that, being able to bring that up to a modern day time and understand how those conditions are changing and people's needs are changing, that's more of a integrative approach. So integrative medicine, regardless of the modality, because there's lots of different types of modalities, regardless of the modality, it's more about how people are looked at, how they're diagnosed, how they're treated, so that the approach and the protocol and the methodology follows that integrative approach, so that we can shift gears if we need to shift gears and not be stuck reading a book and trying to understand people through a tiny lens. I think that
Yes.
is the integrative approach.
Yes, yes, sounds wonderful. I think too, like, as someone who access services, sometimes you hear, or you might have brought on you as a patient in terms of traditional healthcare approaches, while other options are available. What's your insight or what's your thought around traditional healthcare versus something that is more in line with the integrative approach? What's your thoughts around that and the importance of patients or clients being able to try additional other options other than the traditional way of healthcare?
Okay, I think I'm using the word traditional different than you are.
Yeah.
When I say traditional, I meant like a old school,
Yeah.
because we have traditional Chinese medicine, so that's kind
Yes,
of what
yes,
I meant.
yes.
I'm gonna clarify that. So modern medicine, being the
Yes,
Western modern medicine, I know
yes,
that many people go there first, which is what you should do if you have a doctor these days. Yeah, go see them. Make sure that you keep up with that. But I think that there is a stigma around medicine that is not from that direction. That's modern Western medicine, and I think the other medicines, to be honest, there's a lot more history
mhm,
with the other medicines. Although the modern medicine is more um, journal and science based. That's
yes,
not to say that the other medicines are not proven. I mean, I think everybody could probably remember a time when their grandma said, "Oh, do this thing, take this, or drink a honey water in the morning or something," and then you do it and you feel good. And I don't know why that works,
yes,
but grandma always said to do it, or she always said, "Make sure you, I don't know, splash water in your face in the morning," or she had some ritual. Right?
yes,
And then everybody in the family does that ritual and everybody seems to be healthy and nobody knows why. It doesn't mean that it doesn't work. They just
yes,
prove it in a different way. They prove it through application, not through a medical journal. Those things are not, because we do it differently, it doesn't mean that it's not effective.
yes,
And so those things are getting written down more and more. So this is the medicine that people call alternative. I wouldn't call it alternative. It's all medicine. It's just a different type of medicine, a different way of thinking. Those types of medicines, they don't speak modern language. They often use metaphors to describe, like fire and water. They talk like this, but it doesn't mean, just because they say things like that, it's a different language explaining the same thing. Fire is akin to inflammation. So in a very traditional Chinese approach, an old style Chinese approach like acupuncture, then they would be talking about things like fire, but I translate that to inflammation if we're talking to a medical doctor. So I have
yes,
inflammation here, here, and here. It's the same thing with a different language. But the understanding is a little bit more specific to patterns, disharmony, balance. There's no such thing in modern medicine. Right?
mhm,
Modern medicine is more quantitative, right?
yes,
And also a little bit qualitative, but mostly quantitative. So they're measuring numbers. Your numbers fit in here and here and here. You fit in this box, then you're good. If you're outside the box, then you're no good. So what happens and I've had lots of patients like this, when my numbers are good, I fit in the box, but I don't feel normal. You go to the doctor, they say, I don't know, I don't know, I can't help you. Go and do physio or exercise more. That's what they're giving you, right? So in
yes,
those cases, people get stuck, right? And
yes,
they don't know what to do. So that's where this other medicine comes in. We don't need numbers. We have other diagnostic tools which look at the body specifically, not a broad scope, not you on paper. So I'm not looking at your numbers. I don't care about that. I
yes,
care about looking at you. I want to look in your eye and see how you're feeling and listen to what you're saying.
yes,
So that's more of the medicine that we deal with, which I think has its place, and I think is very important in especially today, because I feel like I hear a lot of people, and I get it because there's stressful times. A lot of people complain that their physicians don't listen.
yes,
I hear this all the time, right? They're nice people, and they do great work, but they don't listen because they don't have time. They have so many patients and so much stress.
mhm,
It's very difficult, right? And so they script and okay, off you go. And then I'm already an hour behind,
mhm,
so off you go, off you go.
yes,
So but the other medicines, they don't deal with people like this. They can't, because integrative medicine doesn't work like this. We need to work with the person. So I
mhm,
need to hear everything. If it means I have to spend an hour with you so you can unload, then that's what I have to do.
yes,
So it works more like this at the person, with the person, for the person, as opposed to just understanding symptomatically what's going on.
I love how you describe things so others can understand what you're speaking to. Because sometimes when you hear healthcare professionals speak, it's like they're speaking a different language.
Hmm.
I was speaking to one of my doctors yesterday, and he started using technical language, and I said, "Oh man, I thought you were such a cool doctor. You just nerd up my old process." He started laughing, but how you approach and speak and connect to patient is so important.
Very
Can
important.
can you share with us a few of the common conditions or concerns that you help patients manage?
Common conditions. Oh wow, I have lots of those. I mean, we have simple stuff like muscular skeletal things, which would be like a back pain, neck pain, shoulder pain, numb hands, numb feet, things like that, which are all, I'm going to be honest, they're very, very easy to fix.
Mm,
Um, so those things, I mean, they happen every single day. I have lots of those kinds of people. So any kind of pain or injuries, we
yes.
can work on those things. The harder things are when we get to more of the mental things. So a lot of mental health we're dealing with now.
Mhm.
So there's lots of anxiety, with the world as it is, the depression.
Yes.
There's a lot of stress, PTSD, those kinds of things. We deal with a lot of those.
Yes.
Um, and we lots of digestive issues, tons and tons. I could go on all day about digestive issues. Um,
Yes.
Lots of digestive issues, and then even things like cancers and things like that. We have lots of those cases as well.
Mm.
So it's all across the board really. And I have people that are I've treated people. I've a 2-week-old baby, so
Mhm.
it's like a full gamut of people, and I think that the practice kind of really speaks for itself because the when I get a patient, I usually end up getting their whole family. They end up bringing their whole family to see me, so I get 4 generations, 3 or 4 generations normally. That's a normal thing for me. I think that's because there's a lot of trust. They
Yes.
know that I'm there to listen and I'm really listening to what they're saying. I'm not dismissing them like, okay, yeah, you're saying this, and then no, the book says this, so you don't have that. Go away. It's not like that. I'm listening. I actually really care about how they're feeling and how they're saying their thing, and I'm looking at them and trying to understand, and not just, even if I've done it 1,000 times before, I'm looking at it like it's my first time so that they know there's care there. That's important, especially today, because
Yes.
there's not enough care and there's just not enough good people. So we need to do that. We need to help people, even if the help is just being kind. That's part of it. That's part of the medicine.
Yes. What's one quick thing you can say to someone who's looking to try integrative medicine?
I would say that keep an open mind.
Mhm.
Uh, Go and do a consultation with somebody, especially if you're kind of skeptical. Talk to the person first. See how they can help you.
Yes.
I often do that with people. Is just I just chat with them and say, well, these are the things I can do for you. Maybe they'll help you. Maybe they won't. But maybe it'll open your mind, and then maybe I'm not the right person. Maybe there is someone, and I can point you in that direction too. If it is a Western doctor, then I'll definitely point you there.
Yes, the
Um,
doctor
you
is
know,
so important. You're watching Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. We are exploring integrative medicine with NguiStyle Integrative Medicine Clinic. We'll be right back. Welcome back to Health 180 with Carrie and Fallon Rogers TV. We're continuing our conversation on integrative medicine with NguiStyle Integrative Medicine Clinic. Justin is back with me to share more about what you should know about integrative medicine. Justin, how does integrative medicine address chronic conditions differently? For instance, you had mentioned in regards to pain.
hmm
Can you share a bit about that for us?
I can. So pain is a tricky thing because pain often really affects people at not just a physical level, but a mental level and an emotional level as well. So a lot of people that experience chronic pain, they're kind of grumpy, which is expected. You know, their energy is being sucked away because they're having to constantly deal with pain. So they also, their cognitive ability is less. They don't think clearly. They're kind of brain foggy because you're always focused on pain. So
Mhm.
we treat in a multifaceted way, and we try to figure out sometimes pain doesn't necessarily start from the physical place. Sometimes physical pain can start from mental place. So
Mhm.
we find an avenue in which the source of the pain is coming from. So it's not always what people think. And so we start with that focused source avenue first. So let's say I have a pain in my back, for example, and I've been to Cairo, I've been to physio, I've been everywhere, and it kind of gets better, but it's still there, and then it just seems to get worse, and it never really gets better. And so I have people like this all the time, and they come in, and then I look at them, we diagnose, we talk, and then I say, you know what, I really don't think your pain is coming from your back. I think it's coming maybe starting from the mind and then migrating towards the back. So
Oh.
we're going to do something to address the mental part first.
Mhm.
And once we do that, I'm going to focus on the back. And when we do stuff like that, when we find the source of where it's coming from, that pain is gone. It's instant and it's lasting. I've had people do that. Come to me with that. Have been dealing with pain for more than a decade sometimes, and then I see their kids eventually, and then they're bringing their children to me. Oh my God, I haven't seen you for 10 years. Oh,
Yeah.
what's happening? Oh, here's my kid. Wow, I want you to look at my kid for me. This is a normal occurrence for me. So really, really interesting stuff because not always what you think it is and where it's coming from, especially when it's complicated and
Yeah.
especially when you don't seem to be finding answers. The integrative approach might be the thing that you're looking for.
I think you said something crucial there because often we don't think about how stress impact our body or how
Yes.
stress might impact our mood and how it correlates with pain and everyday life and how you react to people.
Yes.
We don't really think about it from that perspective. In terms of collaboration and for other healthcare providers. How do
Hmm.
you work with other healthcare provider in providing the services that you do? Because sometimes patients need multiple care providers. Is that something that's common, and how do you approach that?
Hmm. Yeah, I think it's very common. I think it's very common for people to engage in multiple modalities. For example, the physio, and then Western doctor, or even like oncology or something like this from cancer point of view. So you've got your oncology, maybe a physio, personal trainer, dietitian, and then you have your integrative person. So I like to be the bridge between all those things because all those things are very specialized, but not everyone knows how to. I'm going to use the word integrate. That's kind of a nail on the head there, but integrate all those things together. So I usually work with the patients to figure out how can we make these things work together, and then if I need to, I'm contacting those other practitioners or doctors or what have you, and then letting them know my thoughts and seeing how what I do can help them and what they do can help me, and
Mhm.
just try to work as a team. I don't, again, like I just don't think that there's enough of that, and I think that is the future of medicine is just more teamwork and understanding where people shine and then helping them shine, not letting the egos get in the way, and just saying, this medicine works better than mine in this case, and let's push that forward, and then I can help where I can help, or I can support where I can support, and that's enough. The objective is to help people feel better, you
Mhm.
know. And I think we sometimes we tend to lose sight of that
Mhm.
um, by being the best, and the best is good, but we're trying to be the best we can for others. So
Mhm.
we're still serving here. So I
Yes.
think as long as we're keeping that in mind, and I try to with my patients, is just have their best interests in mind, and then work with whoever they're working with.
So,
That's how I would.
what role do natural therapies or supplement play in your treatments?
Natural therapies, like such as herbs and things like that.
Hmm.
Yeah, so that I mean, we often have a lot of herbal formulas that we prescribe. That's a pretty common thing for Chinese medicine. So well, that's based on a prescription, based on a diagnosis that I do with the patient. And then we'll often do lots of lifestyle changes. So I'll adjust their sleep, their timing for food, how much activity or how little activity. And so all those things come into play, and most of it is would be considered a natural therapy. And I think we start there because the body really does understand how to fix itself. Just like you don't need to stare at your cut when you get a cut. The body will fix it. You don't need to look at it, right? So the body knows how to do it. It's just that sometimes things get in the way, and if we, give ourselves more of a natural healing process, then sometimes we can overcome those things naturally.
Yeah. So, how do you personalize care plans for each individual patient?
Oh, that's really an important question. I think that when you sit down with someone, you can feel that they have something different about them. Every person is very, very different, right? So there's really nobody that's completely identical. So if two people have back pain, for example, like I said, one could be coming from the brain, and the other one could be purely an injury. And so the treatment plan is very, very different between those two people who have seemingly the same pain. So being able to really sit and listen and discern where the problem is coming from, and we have markers and special diagnostic tools that have been refined over those generations I was talking about, in which we lean on heavily to determine what those things are, where the source is, and why those people are different. And we really have to just take time to do it and not just blankly take their symptom and then assume we know what's going on. We have to investigate.
Mm. Are there any emerging trends or innovations in integrative healthcare right now?
I think the biggest emerging trend is that the technology sector, so the computers and the vibrational therapy, so being able to access frequencies, different frequencies on different people, and eliciting those frequencies to create a cellular response and watching the cells change as the frequency changes. That's pretty interesting stuff. But that's all to do with computers and electronics and things of that nature. My father heads that department, so he's the person to talk to about that kind of stuff. I'm the old man. I'm the one who likes the like old school. Give me a needle, I'll do some acupuncture, I'll do some
Yeah,
meditation with you. He's the new age guy. He's the new age tech guy. I'm the
your
old man.
father is.
My father, yeah.
Wouldn't it be the reverse?
No, not with us. Not with us.
No, it's you mentioned something there in terms of brain waves and technology and stuff like that. I'm familiar
Hmm.
with how you use the computer in terms of brainwave to treat like brain retraining and stuff like that. It's amazing to
Yes.
see how
Yeah.
that actually works to kind of relax the mind
Yes.
and help patients who, for instance, who like, do you actually deal with any patients with like concussions and stuff like that?
Absolutely. Yeah.
Oh,
Concussions
yeah.
all the time. Yeah. Absolutely.
Okay.
Yeah. Yeah.
How important is patient education in your model of care?
Oh, it's huge. It's huge. It's number one, probably. When I teach these classes as well, meditation, qigong, kung fu, things like that, and when we do the classes, I often am educating people and telling them why we're doing what we're doing, and treatments in the clinic are no different. When we start with treatments, I'm usually explaining to the patient what the diagnosis is, how I got to that diagnosis, and what I'm observing in their behavior, in their movement, in the way they talk, the way they carry themselves, and why those things are impactful in how I treat them. because their body's going to respond in a certain way. Someone who's very high strung, for example, if I massage them or do some acupressure or try to relax them from some way, they may resist very heavily because they have PTSD, for example. Right? So I cannot just go in and start putting my hands on their body and trying to massage them because they'll just resist. That's not smart, right? So if I notice those things, then instead of going in and touching the patient and working with them really quickly, I will often just sit and kind of mentally bring them down a couple notches, get them to relax in the mind, let them do a meditation first before I start doing anything. And they're wondering why I'm doing the meditation. While I'm doing that with them, I'm telling them that I'm noticing these kinds of changes. Then they start relaxing, and then I can get to the medicine. So those things are really important to understand. And so we kind of go through that with patients and take a very personalized approach at how we treat people.
If you could leave our viewers with one message about integrative medicine, what would it be?
If you find that something's missing, try integrative medicine. This might be the missing piece of the puzzle you've been looking for, where everything's just not quite right.
Yes.
And you just don't know where to go next, because usually that's when people find me.
Okay, that's great. That's all the time we have for today's episode of Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. Thank you to Justin at NguiStyle Integrative Medicine for joining us, and thank you for watching. And remember, together we are stronger.